Here we go. So Happy New Year, everyone. I'd like to welcome you all to the January 2022 session of the Erie County Workforce Collaborative Training Series. The Erie County Department of Mental Health is so happy to be able to offer these trainings to the dedicated providers in our community to support workforce retention and provide an opportunity for individuals from our provider community to share their expertise. Today, we're excited to have Heidi Billittier and Janelle Thiessen to talk with us about aging and mental health, climbing a mountain of stigma. We are working to confirm our February 22 session of the training series, and notices will be sent out. And you can check the erie.gov mental health website for announcements and registration information. All of the sessions are the fourth Tuesday of the month from noon to 1, and I'd encourage you to mark your calendars and watch for notices for future events. All of the presentations and recordings for the past offerings are posted on our website, and I'd encourage you to check those out as well. At the end of the session, we will be asking you to complete a very brief evaluation. We hope you will take a moment to fill this out so we can continue to improve. This is a community collaborative, and we are looking for volunteers to share their expertise with our community of providers. If you're interested in doing a 1-hour presentation or interested in a particular topic, you can indicate that on the evaluation or contact me, Amy Rockwood, at amy.rockwood@erie.gov. This training will be recorded. Everyone is muted, so if you have questions, please put them in the chat box. Kathleen Larson from the Erie County Department of Mental Health is helping and will be monitoring the chat for us during the session. Thank you all for joining us today, and I'd like to now introduce Heidi Billittier and Janelle Thiessen for their presentation on aging and mental health, climbing a mountain of stigma. Thank you so much for being here, Heidi and Janelle, and it's all yours.
Thank you, Amy.
Thank you.
And thank you everyone for joining us today to talk about a subject that is near and dear to our hearts and likely most of yours as well. Just want to start off by inviting everyone to participate as much as you feel that you'd like to. There are opportunities throughout the presentation to, as Amy mentioned, enter some information into the chat box so that we can kind of have this sort of virtual dialogue. We learn from you as well. This presentation is somewhat new to us, so we're always looking for feedback, and we obviously want to make it as interesting as possible. So thank you in advance for helping us with that. So the subject of aging and mental health, I think obviously it's something that we are all very much aware of, but so many things came to light, I think, during these past 24 months. And so the work that I do specifically with older adults, we've seen so many people struggling, and we're going to talk a little bit about what are some of the barriers for folks who need some mental health support, and what does the stigma around mental health, what role does that play in working against the population that we're all trying to serve. So let's first start by talking about the problem. So the problem, and this is just sort of to set the stage, and this is something that I'm sure you're all aware of, but many older adults don't seek mental health services. And why is that? Well, there's sort of a generational component, and certainly there are also cultural implications. So thinking about your own family and your own life, and what was it like in your home, whatever that looked like, it would have been conducive to looking outside of the home for mental health support. Is that something perhaps that your family traditionally managed unto itself? What did that look like? And then the stigma around mental health and aging, what our culture kind of does inadvertently to set people up for failure by leaning into the stigma. what we're going to talk about today are ways in which we can work together to try to break that down a little bit. So stigma around mental health and aging together present this sort of double whammy effect for those of us who are working with older adults in our communities. Threw this in because it is so important to always talk about the depression factor. It weighs in very heavily with older people because, as again, you probably all are aware, unfortunately, depression has been described as part of a normal aging process. It really isn't. It isn't any more normal for someone of an older age than it would be for someone of a younger age. But because there is this sort of assumption that is made, we sometimes don't spend the time and energy to help people move through their depression. And that can lead into a whole slew of other issues that we're going to touch upon. So again, why is this happening? And we're going to come back to the question in a second because I'm going to ask all of you to participate a little bit. So why is this happening? Again, resisting talking about mental health could have been upbringing, could be fears, could be due to cultural norms. Thinking a lot about the people that we serve and their commitment to maintaining their independence in later years and throughout the course of their life. If someone is struggling with mental health, what does that look like for an older person? Sometimes it could look like dementia, because certainly dementia symptoms of dementia align very often with those associated with major depressive disorder. So being able to sort that through, but maybe a reason why some older individuals do not seek treatment, do not want to draw attention to depression, as it might be misinterpreted as an age-related malady. And then we all know that many times older people, all of us, we want to age well, we want to take care of ourselves. Independence is the one thing that we all want to hold on to, right? That's why we don't want to give up our car keys, for example. We want to hold on to our independence. So asking for help, reaching outside of the family, very uncomfortable for many people. Okay. And so we absolutely have to consider the cultural implications, right? As we all already kind of touched on, each culture has a unique lens through which they understand mental health. And that determines very often their comfort level in discussing and then seeking treatment for. Understanding symptoms. So culture can influence how people describe and feel their symptoms. Many times, as you have all probably experienced, mental and physical health become one and the same. They coexist. So how do you separate that out? And people interpret those issues differently, again, depending on their culture, depending on their life experience. Community support, thinking about the areas in which we live. Some of the areas around Western New York are more supportive of people who are living with a mental health diagnosis. Some are more age-friendly than others. So what cultural factors? Is there a community center that embraces people of all ages, supports mental health? Could be a factor. And then resources, culturally appropriate resources, and also culturally compatible mental and physical health professionals. Something to think about. Okay. I'm going to turn it over to Janelle, I believe, for the next slide.
Hi, good afternoon, everybody. So I'm going to start getting into the mental health side of the presentation. The impact of mental health on older adults. An estimated 26% of Americans ages 18 and older, or about 1 in 4 adults, suffer from a diagnosable mental health disorder in any given year. And many people suffer from more than one mental health disorder at any given time. One thing that I think we've all seen is a lot of these mental health concerns have been exacerbated by the pandemic. We almost have a dual pandemic going on. I'll get into that a little bit more, but we have people with mental health disorders. And now we are also seeing an increase in isolation and loneliness among a lot of people, but especially older adults. And that's sort of exacerbating some of these mental health issues. Due to the population aging, the number of people who are experiencing mental health disorders will double by the year 2030. Depression is the most common mental health problem among older adults, and it is the leading cause of disability around the world. People age 85 and older have the highest suicide rates among any age group, and 2/3 of older people do not get the mental health care and treatment that they need. And that was, Heidi sort of touched on that a little bit regarding the barriers and the cultural barriers that come with that. In general, mental health services for older adults are very limited in North and South America. So I'm going to get into the risk factors for, I'm going to go a little out of order here. Risk factors for depression in older people: being female, being single, divorced, or widowed, certain medications or combinations, lack of supportive social network. I will get into that more on the next slide. Stressful life events, chronic diseases, chronic pain, loss, fear of death, and a loss of purpose. And that's something else that we will get into later on in the presentation. I'm sure for anybody who works with older adults, none of these risk factors are a surprise to anybody, but of course they are good to be aware of as people who work with this population. Okay, loneliness has been identified as a major health concern, and there is a difference between loneliness and isolation. Loneliness is the feeling of being alone, regardless of the number of social connections a person has. I think we've all heard the expression where, you know, you can feel alone in a crowded room. It's, you could live in a house full of 10 people, but you could still feel lonely. Social isolation is just the overall lack of social connections between an individual and their community. This really does tie in with mental health concerns that we discussed already for various reasons. If a person is isolated, it makes it more difficult for us as the mental health professionals to notice the signs and symptoms and link them with proper treatment. There are a lot of reasons why people are isolated, especially among older adults. One reason would be the changing neighborhoods and gentrification. You often hear about those older people who stay in their own neighborhood. They want to age in their neighborhood, remain in their home. But with gentrification, you tend to see younger populations moving in to these neighborhoods. And for some older adults, that takes away that sense of community. They may have a more difficult time making connections with a younger generation, which kind of goes into my next point. Another reason why older adults feel alone is because they feel left behind. People's lifestyles have changed. Technology has rapidly changed, and this can lead to feelings of being overwhelmed and just that they can't keep up with the way society is. So it makes them feel alone and unable to keep up. Transportation, that is always a variable, a barrier, especially among lower income older adults if they have to rely on public transportation. One group that I don't want to forget about, when we think of older lonely people, we tend to think of single people, widows, widowers. I don't want to forget about the group of caregivers out there. Caregivers can feel very lonely. They tend to be isolated with the person that they're taking care of. They likely don't have time or don't feel like they have time to socialize and to take advantage of activities that they might be interested in. And then immigrants, that is another population that tends to feel more alone, depending on their connections within their community, but immigrants tend to have more of cultural barriers. They may have more difficulty connecting with people. And kind of along the same regard, the LGBTQ population among older adults, that's another group that tends to experience loneliness. They tend to be less likely to have children to rely on, and some of them are estranged from their families, their biological families. So they have less social supports to lean on. The benefits of having social supports, it helps a person's ability to cope with stressful situations and life events. We all know that it's always nice to be able to connect with somebody and share. If you're struggling with a problem, somebody to bounce your ideas off of, or just vent your feelings to somebody. It helps to alleviate the impact of stress and emotional distress. You have people who you can turn to for help. Even with the everyday, those little day-to-day things that somebody needs help with, especially for the older adults, somebody to grab groceries for you, somebody to take care of your laundry, your housekeeping. It's just one less thing for them to worry about. Promotes lifelong good health by reducing physical health concerns such as high blood pressure and cardiovascular disease. I'm going to talk about the risks of loneliness after this, so I'll get into that a little bit more. And then finally, having social connections help keep depression and anxiety manageable. And I think this kind of goes back to that first point I made. It's helpful to be able to talk to somebody about your problems. And whether you have a diagnosis of depression and anxiety, or it's just a difficult time that you're in the midst of experiencing, having somebody to connect with is going to help manage that. Okay, and finally, loneliness and isolation actually present quite a few health risks to people, especially older adults. They are at a 50% increased risk of dementia. Isolated people who have cardiac conditions are at an increased risk of hospitalization and death, trips to the emergency room. People who are isolated tend to engage in unhealthy habits, such as smoking, excessive eating, excessive drinking. They may not bother to take the time for exercise, getting outside, and they just may have overall more sedentary lifestyle. And finally, the increase, being isolated, we tend to see an increased risk of elder abuse, especially neglect. They just might not be taking care of their physical appearance as much as they should. Bathing, getting dressed, managing their health conditions. They may not go for regular routine checkups. And we also see an increase in financial abuse. Isolated people tend to be the target of scammers, of those financial scams, those phone calls, because sometimes they're just looking for a connection, and they may be so desperate for that connection with somebody that they may not consider the decision that they're making. They just may be sharing information which is going to get them involved in a scam or some sort of financial trouble. All right, I am going to turn it back over to Heidi.
Thank you. So I realized that on the first slide, I was going to invite everyone to put into the chat box any ideas around what kinds of barriers you note that get in the way of older people accessing mental health services. So I want to be true to my word, and because I want this to be interactive, if you don't mind going ahead and doing that, think a little bit about what types of barriers that you are aware of that could potentially get in the way of older people receiving, accessing mental health services. And what I'll do is I'll kind of continue through the presentation, but then Kathleen, if you see that there's something that we can maybe talk about, we can sort of circle back. Oh, I'm seeing them already.
I was going to say we have a few coming in already. So we've got weather, transportation, computer, technology.
Absolutely.
COVID.
Yeah, that's a big one. Insurance. Thank you.
Yeah, and COVID definitely contributed to the isolation as well, that dual pandemic that I mentioned early on. The isolation is really part of that.
A few more: cultural pride, lack of awareness of symptoms, more for transportation, availability of resources in lower income communities, loss, feelings of shame, no family support.
I'm seeing, do you know how to use a computer? That's a good one too, because especially during this, our current pandemic situation, many of our services have gone virtual. And if you don't have the tech savvy, if you don't have the equipment and you don't have the knowledge, that takes you out unless you're willing to have a phone call. And that does work for some. It doesn't work for everyone. So, right.
And it could kind of exacerbate some of those feelings of aloneness. Like I kind of touched on that a little bit, that technology piece, feeling overwhelmed by the technology. And it's just kind of the cycle. Like technology is how to connect with somebody, but if they're feeling overwhelmed by the technology, then they're kind of stuck.
Right. Feelings of shame. Absolutely. These are great. Yeah, thank you.
Lack of patience from the younger clinicians. Younger people talk faster, use acronyms and language that is unfamiliar to seniors. That's a good one.
Yeah, that is a good one. I like that. Absolutely. So not really culturally appropriate, right?
Language and hearing loss.
Yep.
Mm-hmm.
And now, sometimes, if you have the privilege of being in the same room as someone, what are we wearing? Well, we're wearing masks. Another barrier.
Yeah.
So these are great. Thank you so much. I'm really glad I went back to that. I do apologize. So I wanted to, so again, as we move forward, we've sort of stated the problem. We know what's going on a little bit. We're starting the conversation right now. And at the very root of all of this could be language, right? These are little subtle changes that we can make ourselves. We can help our interns. We can talk with our colleagues. Language around both mental health and aging is something that we can actually impact. So we'll talk on the next slide a little bit about the Anti-Stigma Coalition taking the pledge. Yes, we're going to encourage you to do that. But also thinking about the language around aging. And if we're using terms like, silver tsunami and frail and elderly, what are we doing to encourage the older adult population to continue to engage and grow? So we want to see what can we do to normalize mental health challenges among older people, normalize aging, because for heaven's sakes, it's not an us versus them thing, right? we're all, I imagine that we're all kind of on this moving sidewalk going through the airport, right? And we're all kind of heading in the same direction, whatever that looks like for all of us. But we are all going in the same direction on the same moving sidewalk. Yet why do we continually separate out according to age? And what does that do for the people who are older than many of us? Okay, so educate, evidence-based programs. I threw in mental health first aid because that's a Compeer thing, but it's a great program in general, but there are so many evidence-based programs that speak to older adults, their mental health, their physical health. We'll actually touch on those, I think, in the next slide. And then reframing aging. So I do want to talk about reframing aging because it is sort of the underpinning of this whole presentation. Reframing aging, I'm going to encourage all of you, if you would, that we'll put it in the chat box, but it's reframingaging.org. And if we go to the next slide, I think I may have included it or not yet. I will. Yes, there it is. Reframingaging.org. You'll hear, I'm hoping that we're all going to hear a lot more about this initiative. So this initiative came about, I think, about 2012, where 8 large agencies, all serving older adults in our country, decided finally they wanted to find out, what do people think about aging? What is the consensus? What are we thinking? What's controlling the way that we think about aging? So I think, again, I want you to, if you can, go to that page and see some of the thoughts around that are just amazing. And little tiny things that we can all do to kind of contribute to lifting up this part of the population that we are all going to soon be part of if we're lucky. So leaving behind the ageism, it's discrimination, it shapes the way we think about ourselves and others. And then that leads very nicely into the self-fulfilling prophecy. If we believe that people can't do something, they will likely not do that thing, right? I think about the kiddos in school, and if you have a teacher who is constantly sending you a message that you can't do something or that you're not able and that you're not, you don't have the competence, what are you going to do? It's going to take a lot of strength to move past that. No, we're going to probably meet that expectation. And maybe the biggest loss for all of us is that we're missing out on this amazingly valuable resource. You know, retirement is difficult enough. And in some cases, I don't even know if there's mandatory retirement anymore, but sometimes people are very gently pushed out. And there goes the livelihood. And this is where we're going to kind of circle back and talk a bit about putting purpose back in place after important things like work is no longer there. But thinking about participation of older people in our workplace, in volunteer settings, in paid settings, in consultant settings. Unfortunately, we don't take advantage of that resource enough. And so all of the stigma associated with aging feeds into the loss of this precious resource. And the sun came out. Sorry, guys. And moving on, and I'm not complaining. Okay.
Next slide, right? Yeah, there we go.
So, yeah. So again, as I had mentioned before, kind of thinking, and I know that all of you who have been working with older people for many years have seen the transition from one politically correct term to another. So I think when I started working in the field, it was elderly, perhaps. We were referring to people who were older as elderly or geriatric. I remember that. Seniors, and many older people refer to themselves as seniors, and that's fine. I think where we landed, at least for now, and please anybody put in the chat box if you know differently, is we are kind of comfortable with older people or older Americans. So truly, if there's anything I'm missing, because it evolves. But what we're trying to do is make the language more inclusive. So, and shifting the perception from a them to us and we. Okay. And then very specifically about, oh no, you're good. Perfect. Perfect.
Okay.
So the Reframing Aging initiative has, and we're going to share an info graphic with you after the presentation, maybe in the next day or two, it will come to you. But really thinking about how we can reframe the way we think and the language that we use around aging. So I was thinking about this silver tsunami thing, and Janelle and I were talking about, back in school, and we probably both used the term, and it's not a horrible thing to say, but it does have implications. It does paint a picture, right? So a tsunami is like a dangerous response to an earthquake or a volcanic event. So a tsunami is not necessarily perceived as a positive thing, is what I'm trying to say. So you hear a tsunami's coming, you're not going to want to celebrate, right? So it can be demeaning. It paints a negative picture around aging. So I wanted to ask again, because I know that many of you are working with older people, but any people. What kinds of things have you heard yourself, or maybe even said, and I can give you a laundry list of things that I've said myself that could be interpreted as stigmatizing around aging specifically? What kinds of things have you heard?
Michelle says the YMCA uses Silver Sneakers as the program title for their exercise program for older population. I always thought older people were in their golden years, not silver years. And also the term blue hairs.
Oh my gosh,
Yes.
That's so funny. That's absolutely true. And the Silver Sneakers I think it's a brand. So it's kind of across the board. The Silver Sneakers, I think, it's an independent health initiative. And you're right, Silver Sneakers, what could we do differently with that? I'm sure that all of you can think of 100 different ways to brand that. But blue hair, yeah. Anything else around stigma? Anything else around stigmatizing language that you've heard? How about senior moment? I've heard that. I've heard older adults use senior moment. And I think to myself, well, why isn't it just I forgot something? I happen to forget something. Why is it okay that I can forget when I'm in my 20s and 30s, but when I'm in my 80s, now it's serious. Now it's something, and we have to pay attention to it. So yeah, just thinking about that language. And again, we'll share with you this tip sheet. It's kind of cool. How do you reframe something that has sort of a negative spin and turn it into something positive so that we start to perceive aging in a whole different kind of way?
Just one last one that came in was Silver Seniors. Garrett said there's a group in his area called Silver Seniors.
Right. Yep. Okay.
Great. Okay. Where do we go from here? Sorry, this section's a little all over the place. Okay. Like I said before, we were gonna get into purpose and the value of purpose. And what we mean by purpose, it's having goals, having a sense of direction, feeling that there's meaning to life. Oftentimes older adults struggle with their sense of purpose after retirement. They no longer have their day-to-day routine of going to their job that they had for who knows how many years. And, that was their day-to-day purpose for probably decades. And then there's the issue of your children growing up and leaving the nest and beginning families of their own. They don't rely on their parents anymore. And for some people, that was their purpose, their sole purpose for a long time. So as we age, we need to reevaluate our lives and find maybe a renewed sense of purpose. And maybe that's starting something new, a new hobby, or maybe that's building off of your previous purpose, such as, you know, you're no longer taking care of your kids, but maybe you'll help with the grandkids, or maybe you'll volunteer based, doing something based on what your previous career was. But we'll get into that a little more on the next slide. The importance of purpose, it promotes healthier behaviors that are associated with improved physical and mental health outcomes. People who have a purpose tend to have fewer chronic conditions, less disability, reduced mortality. I'd argue that people who have a purpose and who have a reason to get up in the morning and get out of the house, or, you know, just use their, challenge their brain, challenge their body, they're most likely less isolated, which is what we spent a lot of time talking about before. They will most likely have more social connections and be more linked within their communities. It is associated with overall higher quality of life, a stronger sense of well-being. Once again, those connections and that sense of community. And then having a strong sense of purpose reduces feelings of loneliness. So all of this is sort of tying together. So for the various ways that people may seek out purpose can link them more to find some social connections. So finding purpose, like I kind of touched on a little bit, volunteering, maybe utilizing skills from your previous career or experience, and that can help you make a difference in the lives of others. Sometimes you hear about retired teachers going back and substituting, or that's not really an example of volunteering, but maybe kind of a second career some people tend to do. Or there's like the foster grandparent program that's been in schools. There's so many different volunteer opportunities out there. Focusing on hobbies and talents. You know, when you're working and you're raising your kids, you're so busy, and people tend to feel so overwhelmed, and they say, I don't have time for hobbies. Well, now you do, and you could really spend some time on it, learn something new, maybe a new language, maybe you always wanted to learn how to knit or paint or whatever the case may be. And from there, that may turn into finding a group. Like, I know a lot of the senior centers have groups related to hobbies and clubs, and from there you can start maybe making more social connections and creating a sense of community, whatever the hobby may be. Work on maintaining relationships with families and friends, you know, regular lunch clubs, babysitting grandkids, planning social activities, traveling, joining a senior center or some sort of social group. And I know there are some seniors, I kind of talked about how technology overwhelms older people, but some people are very interested in learning and keeping up with the new technology out there. So there may be some people who really want to learn Zoom, and then that's how they connect with family, especially those that don't live locally. Staying on top of your physical health, making sure that you regularly see your doctor for your routine checkups, healthy diet, or maintaining some sort of exercise routine. And that can also kind of go hand in hand with socializing and connecting with others. Maybe you could join a walking club or hike or whatever. Of course, this is all dependent on physical ability. I mean, regardless of age, everybody has different physical abilities. But the point is, people can find their purpose based on what interests them and based on their individual abilities. And then finally, finding joy in those everyday simple pleasures. You know, like today, the sun is shining. That's always nice to see in January. You know, just nature and a warm cup of coffee, you know, whatever makes people happy. If you try to find something pleasant in your day, you will be able to. And sometimes that's, for some people, that's just a good place to start. Oh, I'm sorry. Oh, I went too far. Okay, so spreading the word. So as professionals in the field, we want to provide linkage to resources for our clients and those that we're trying to assist. Counseling, social programs like adult day programs, the local, whatever local senior center your area is affiliated with. Peer support like Compeer, evidence-based programs. I also think as professionals and clinicians, we need to be aware of the signs of depression, anxiety, isolation, loneliness, and from there, you know, identify those who are at risk and link them with the community resources that would be appropriate to assist them. And then the last thing is we wanted to invite you all to take the pledge, the Erie County Anti-Stigma Coalition. And you are pledging that, do you want to get into this a little more, Heidi?
Oh, Heidi, I think you might be muted.
I'm sorry.
She's on mute.
Yeah, this is quick. It'll take about 30 seconds, I think, to click on the link and go in. And really what you're committing to is to think about really very much what we talked about earlier. Think about your language around mental health. So clearing out your closet of all those probably unintentional negative stereotypes, sweep them away, and think about new ways to talk about mental health, because we definitely want to talk about it, but we also don't want to set people up to perceive mental health in negative kinds of ways. So see what you think. It'll just take a second. Actually, it's much appreciated. And my hope is maybe next time you hear from us, we'll have some type of a pledge that you'll be able to take around aging, specifically language around aging. And I think, again, that's where the Reframing Aging initiative comes in to play. And hopefully we'll be able to engage with them with a larger group as well down the road. So.
And Amy did put the link to the Reframing Aging infographic in the chat for anyone who wants to look at it.
Thank you.
Thank you. Great. Here's our contact information. We would appreciate any feedback that you might have. Like Heidi said, we're still kind of working out the kinks of this and building it up. So we would welcome any feedback that anybody may have.
Great. And finally, I think if anyone has any additional thoughts or questions, we certainly want to allow for that as well.
We do have one question that just came in. Are there recommendations for specific resources for older adults?
So, Amy, is that regarding mental health specifically or other?
That was Kathleen.
It was Kathleen?
No, Amy, one of our participants,
Oh,
put in the question.
Because we certainly can provide resources. That's never a problem, as all of you who work in social services know. We have a million of them. It's just linking people to the correct services, the services that they really need.
I think a good first step in general, mental
No,
health.
mental health. Mhm.
Mental health, right. So I think, my go-to, and I know Shannon is on or is JFS for, I've linked many older adults for counseling with Jewish Family Services because they're terrific. They've been very flexible with the older adult population and adapted to all the restrictions during COVID. So that would be a counseling referral. Best Self is another good resource. For peer support, if you have a client who is stable in their mental health treatment and your feeling as a professional is that they could benefit from having a friend in their life, Compeer might be a good fit. Also, Western New York Independent Living is a good resource for peers, so trained peers. So those individuals would have a little bit more training under their belt than the Compeer volunteer around mental health. Anything else? There's so many resources, so many places my go-to, where I always start when I'm talking about older adults, almost no matter what it is I go to the county. I want to check in with the county to see what's available, to brainstorm with the caseworkers and come up with a plan. So definitely New York Connects, great resource. Hold on to that telephone number too.
Shannon from JFS just typed in their intake phone number for anyone who would like that.
Thanks, Shannon.
And it looks like Nadia put in a link for Medicare Senior Services Health Insurance as well.
Great. Thanks, Nadia.
Thank you.
Excellent. Excellent.
But yeah, it's just to go off of what Heidi said, New York Connects is a great resource as well. It's linked with senior services, so someone can call New York Connects and get a lot of information and resources and linkages to all sorts of services.
Yeah. So transportation, oh boy, that's such a good question and one that we've all been asking. I can tell you what I know about transportation, non-medical, and it isn't good. Hearts and Hands are a resource. Don't know their availability. There's also transportation through Erie County Department of Senior Services, something worth looking into. Depending on the individual's living situation, age, and I believe disability status. I may be mistaken. I'm thinking of paratransit, PAL, through NFPA.
You have to qualify for that based on your medical disability.
Right.
Yeah. There could be a cognitive disability as well, but you do have to have a qualification for it.
Okay, so that's a possibility. And I mean, I know
like local senior centers too.
Local senior centers, absolutely. If you're in the right zip code, an organization like Canopy of Neighbors will provide some transportation. And I don't know what their priority is in terms of medical versus non-medical, but that's another resource certainly worth checking into. The bottom line is there's not enough. And I think we've all felt that. We just don't have enough transportation for people to get to social activities. The day will hopefully come where socialization is looked at as important as the mental health piece and the physical health piece. Individuals need to be social, but we're not there yet, but we'll push for it. Anything else? Yeah, Amy, absolutely. Thanks, Michelle. Oh,
I didn't know that.
interesting.
Yeah, Michelle said anyone with a Medicare card, oh, my screen just moved, can get a half fare card from NFTA. The application is online.
Okay, great.
And then paratransit, if someone is approved for paratransit, their paratransit card allows them to ride the metro, rail, and regular buses for free.
Okay.
And then Alexandra said, are there any good senior group functions, maybe with a mental health component?
Wow, that's a tough one right now. I think it's up to the individual senior centers in the area. who as to who's doing what. I believe Amherst Senior Center, for example, was at least starting to have activities again. Others are not having older adults in the building. Westside Community Services is very gradually, for example, building back up a little bit. I think everybody's just taking very deliberate, slow, intelligent steps toward group activities. We had Compeer offered many group activities in person prior to 2020. And unfortunately, those activities had to be put on the back burner. We did a number of things outdoors, weather permitting, but that's a tough one. I think when we get through this particular period, this time that will soon be history, yes, I would say there are opportunities for socialization.
And I'm not sure if you're looking for anything virtual, but I know, and Shannon might still be on, JFS has a virtual support group. So I know it's not in person, it's still virtual, but it is a virtual support group. Either, it can be, via just the phone if someone just has telephone access, or obviously via, video as well. But it definitely has a mental health focus, but also just the older adult support from other older adults going through some similar things. So JFS could be a resource for that.
Yep. Oh, great. Restoration Society. Good resource. All right. Well, I'm going to express gratitude to all of you. Thank you so much for hanging in there with us.
Thank you very much.
Thank you for inviting us into your homes and your offices. And thanks for talking about this such an important subject. And my hope is that we can all get together again down the road and maybe actually move the needle together in terms of how we perceive and how we manage the aging population, because it really is a we, not a them.
Thank you, Heidi and Janelle. And I did notice, Heidi, I made a note of it. Throughout your presentation, you kept saying we, not they. So
right.
That was heard. Thank you.
Thanks.
Thank you, Kathleen, for monitoring the chat, and thank you all for being here today. I pasted the link to the evaluation in the chat box and ask you take a moment to fill that out. I also will be posting the recording from this session on the eriecounty.gov webpage /mental health. What else? We're still working on finalizing the February session. I'll be sending notices out about that as soon as that's finalized. You can also keep an eye on the website, and you can also go to the website to check out all of the past presentations. Again, if you're interested in being a presenter, please let me know. If you have ideas for topics you'd like to learn more about, send me an email or note that in the evaluation as well. And thank you again, Heidi and Janelle. This was wonderful. And thank you all for being part of our collaborative. Have a great day, and we will see you next month.
Thank you.
Thank you.
Thank you.